I am Robin Ross. I am a certified birth doula and certified childbirth educator with a little over 12 years experience. And I am here with Carrie Koziol. She is a women's health physical therapist and prenatal postnatal Pilates specialist. And she is going to discuss with us the importance of exercise prenatally, as well as how that can help with your labor, birth, and post-birth recovery. So I'm going to let Carrie discuss what she sees as the importance and how you can fit this into your lifestyle really easily. Hi, Carrie. Thanks so much for joining us.
Well, thank you so much for having me. I always like talking about anything birth related, especially with you. So when I give these talks out in the community, what I'll often say to women is, what if I told you that there was a pill that you could take with little to no side effects that would reduce backaches, help with constipation, bloating, swelling? It would give you extra energy, but actually help you sleep better at night. The same pill would maybe prevent or even treat gestational diabetes. Would you be willing to try it? What if it decreased your C-section rate too? And of course, most everyone says yes. And I say that's basically what exercise does. With little to no side effects, it has all of those wonderful benefits, especially in your pregnancy time. It might also decrease any sort of postpartum recovery or depressive episodes in the postpartum time. So there's just so many wonderful benefits of exercise. If that exercise includes pelvic floor contracting and relaxing, it can help slide the baby out. It can help decrease urinary incontinence before and afterwards. So many benefits to exercise. And I think where it gets confusing is that the old recommendation used to be if you were doing it before your pregnancy, you can do it during the pregnancy too. And I disagree with that for a couple of reasons. Number one, there are certain things that women were doing before pregnancy that were fine, but now when we incorporate the physiology of their pregnancy and the hormone changes and their pregnancy posture, certain exercises I wouldn't recommend for them to continue doing. And then what does that do for the people that maybe weren't as active as they wanted to be before pregnancy? They're left wondering, what's the recommendation for me? If I wasn't doing something before pregnancy, can I start? And the American College of Obstetricians and Gynecologists has a couple different committee opinions for these. Their first that they released in 2002 basically said, if we look at the general population of humans, basically an accumulation of 30 minutes or more of moderate exercise and most, if not all days of the week is recommended. And in the absence of obstetrics complications, we think pregnant women should adopt this too. So that kind of clarified some of those questions about should we exercise if we haven't exercised before pregnancy. And just as recently as April of this year, 2020, they came out with another position statement that basically the key with this one is they said obstetricians, gynecologists, and other birth providers should be recommending that women either continue or commence exercise in the pregnancy times. Again, stating if you weren't doing anything, don't let that stop you. It's fine to start an exercise program in the prenatal time. The other thing that I'll point out is being sedentary is not great in pregnancy. And in fact, physical activity inactivity is the fourth leading risk factor for mortality worldwide. And when you combine that with weight gain that is associated with obesity and sometimes gestational diabetes, we have a real problem for pregnant women. So we really do want to encourage exercise for pregnant women as long as there are no significant complications. So of course they would get cleared by their OBGYN. And then what are they supposed to do? So now they're convinced, yes, I should exercise, but people can be a little nervous. What types of exercises should they be doing? And so I like to look at what's going on in the pregnant body in terms of the cardiovascular and the hormonal system. I like to look at the pregnancy posture and then look at the demands of the event. So if I was training just a regular person for a triathlon, I would look at like the swim, the bike, the run, and I would design an exercise program so they were successful in all of those events. And birth is no different. As you know birth way better than I do, but there's certain positions that the women have to get into, not just when they're laboring, but when they're actually in transition and pushing, that involve quite a bit of hip flexibility. In that situation, nor do we want to teach her to learn a new skill in the midst and throes of labor and contractions. So a really designed exercise program will appreciate what her pregnant body might have to do in her event, which is birth, and then back it up and develop exercises to help you be successful there. But if I take it even a step further back, when we just look at the cardiovascular system, immediately upon the egg implanting into the womb, the body experiences a total body vasodilation. Blood vessels get bigger, lymphatic channels get bigger, but you have the same amount of blood that is coursing through these now larger vessels, which is really what gives women that underfilled feeling, with feelings of sudden waves of nausea and fatigue and dizziness. It's like this underfilled. The body knows there's bigger vessels, same amount of blood coursing through those vessels, but as a result of that, their heart rate can be elevated even at rest. So where should your heart rate be during exercise? A lot of the research will point to this arbitrary number of 140 beats per minute or less. Once again, I disagree, because I don't think that accounts for your previous fitness level or your body mass index. So I'd rather women follow what we call the rating of perceived exertion. It's a scale that goes from 6 to 20. And in pregnancy, you want to around 11 to 13, which is light to somewhat hard. It's difficult, it's quite a bit of an effort, but you can continue. Or better yet, use the talk test. So if you're exercising and you're gasping for air, and you can't get out what you want to say, you're probably exercising too hard. And even though birth is compared to like an endurance marathon type event, you're really not in a situation where you're exercising in birth to that level of cardiovascular intensity. There's no need to be gasping for air and expect that to carry over to birth. The other thing is, because of this cardiovascular change, your blood pressure can be a little bit altered. So you have to be really careful with changing positions too quickly. And I really have to, as a Pilates instructor, redesign the exercises a little bit so I don't have people laying down, popping up, laying down, popping up. I really try to do all the laying down exercises and then all the side lying exercises and then the exercises on all fours so that I'm appreciating what's happening in her cardiovascular system. The second thing you need to think about is really the hormones in pregnancy. So you have an increased amount of progesterone and relaxin that serve to soften the connective tissue in the joints all over the body, not just in the pelvis. So you really want to choose exercises that keep the pelvis very symmetrical. So things like squatting, fantastic. Things like symmetrical lunges, fantastic. But this wouldn't be the time for like a kickboxing class where one leg is planted and the other leg shoots off into the air, or an aggressive step class where you're up and down off of a step, shearing your pubic bone and your SI joint together. So again, thinking about the mode of exercise and then appreciating with those hormones, you're going to have two areas of vulnerability. One is your deep abdominals, because you have a tiny little band of connective tissue that runs down the center of the abdomen. It's called the linea alba. And that could separate more than it was anatomically designed to do, which we'll talk about in a second. And then the second area of vulnerability is the pelvic floor muscles. So this probably is the time and exercise to be doing a ton of burpees or high impact jumping or wide separation of the legs and jumping jacks and that sort of thing, because pelvic floor muscles are just a little bit more vulnerable and your uterus is heavy. It now has a baby inside of there. So we really don't want the uterus bouncing around and those ligaments stretching and that sort of thing. But when we talk about deep abdominals, I'm going to grab an example really quick. Your outermost abdominal muscles are called the rectus abdominis muscles. So they run like in pairs right down the center of the abdomen. There's always a tiny little space between them. That space is about 0.5 centimeter. So think about the distance between your knuckles. That would be a normal space. Now you have this tiny little band of connective tissue, and I want you to think about it like a piece of silly putty that runs all the way from your sternum down to your pubic bone between those two muscles. In pregnancy, what happens is that because of the progesterone and relaxin, that connective tissue separates, and we want it to do this. This isn't a flaw in the way you were designed. You're designed to birth a baby. We want there to be some give here to make room for the growing baby in your growing uterus. So a little bit of pulling apart of that tissue is completely normal and expected. The problem is, if we, in addition to this strain and this vulnerability, if we now add a ton of crunching exercises, a ton of weighted twists, a ton of time in all fours, that can add extra pressure onto those tissues and pull. The muscles can pull that tissue apart. And if you'll see, it can get almost like opaque in some areas, like see-through. This is now kind of what we would call a diastasis rectus abdominis, the separation of those muscles. And if we continue to do the offending movement, you can see that we're going to create fissures or holes in that connective tissue. That's now a hernia. So we want to be really careful when we design exercises to accommodate for those vulnerabilities, both in the pelvic floor, but also in the deep abdominals. So this isn't a time to do a lot of really aggressive rectus abdominis or oblique work. We'd instead want to concentrate on the deepest abdominal muscle, your transversus abdominis, to help prevent that connective tissue from separating too much, which can also give the appearance of that postpartum pooch, which none of us are really striving for anyway. So keeping that in mind. And then I think it's important to think about the pregnancy posture. So there's a lot of weight that's now in the front this way, leaning forward, which puts a lot of strain on this part of the back. So exercises that plunge through there can be really, really helpful. We also need to think about hip flexibility. So there's a lot of women that are pitched forward. So we need to stretch both the hamstrings and the front, the hip flexors. And then the weight of the growing breasts is bringing women forward. So this isn't the time to do a ton of push-ups or chest work. We actually want to stretch the chest out and start working the postural muscles on the back end of the body. The last thing you're going to think about again is the event. So what position do the hips have to get into, and what sort of exercises can you design to help their hips be more flexible and stronger so that they can support that weight regardless of the birth position that they're in when they birth the baby. So lots of benefits to exercise in pregnancy, but really tailoring your program to appreciate the cardiovascular and hormonal changes, making sure you're not putting too much stress on the pelvic floor or the abdominal muscles, and then appreciating the pregnancy posture and designing exercises that are going to stretch what's tight and strengthen what's weak. And then lastly, appreciating the event and what you're actually going to have to do in birth, and then doing those exercises before birth so they're there for you when you need them. So anyone is designing their own exercises, but I completely appreciate that can be overwhelming. And so in my prenatal Pilates class, I've really tried to take that all into consideration and design exercises and programs so that I can basically hold your hand and walk you through which exercises should be part of your program. And I teach these classes virtually, I teach them in group sessions, and then I even have online classes that people can sign up for, and it gets delivered right into their inbox once a week. And at least you know you have an expert that's designing the programs. Each exercise I look at with a microscope. Does it meet all the criteria? Is it something that's just a pretty Pilates exercise that has no purpose for pregnancy or birth? Or are there things that are not part of a Pilates program that need to be part of this program to make sure that you're heading into birth feeling really prepared? And I always remember the example you gave, Robin. You talk about hypnobirthing and how in the heat of the moment, you can tell the women who've done the hypnobirthing, because as they're about to kind of like spiral off the cliff, they have a few tools to kind of cling on and pull themselves back up. And I kind of think about that with exercise too. It can be really easy to head into that day completely unprepared. And I highly recommend having a set of tools and at least the confidence that you've kind of put your body through the paces so that when you are in the heat of the moment, you can really depend on a body that knows how to support your baby, that knows how to slide your baby out. And these are skills you really don't naturally show up to birth having. You need to train yourself so that you are ready. And this is the most difficult thing your body's going to ever do. It's really worth putting in some time to make sure it's prepared.
I love it. Absolutely. Thank you so much for all this information. I always learn more and more. And I love the visuals you show. I think they really help to give the depth of why exercise is important, not just because of prenatally of why it's so important for labor and birth, but also for the postpartum and healing process and what can develop as a result of those muscles being overstretched. So again, thank you so much for joining us, Carrie, and everybody. You can check out other videos that we've done. One was on urinary incontinence a couple weeks ago, just things to really help you in how you feel and how your body works. You can always contact Carrie as well privately. As she mentioned, she has online classes going on currently, and then she also does private. And like she said, she can also tailor things for your needs as well. So Carrie, again, if you don't mind sharing, how can everybody reach out to you?
Sure. My website is pilatesbycarrie.com, and that's CARRIE.com. And there's a lot of information on there. There's blog posts that you can reference to that talk a lot about some of these same topics that I've discussed with you. And then there's also a contact form. So if you had any questions, you could fill out that form, and pretty good at getting back to people right away.
Fantastic. Thank you so much again. And thank you everybody for joining us and watching us today. Stay tuned for some more videos coming up. And again, any questions you have on exercise, fitness, women's health, things to specialize in what you need, contact Carrie Koziol. Thank you so much again.
Bye. Thanks, Robin.